Hi, it's Dr. Centeno, and today we're going to talk about what are the least common CCI symptoms. I've already done a video on the most common, so these are the least common. I want you to like, comment, share, and subscribe because that's how you pay it forward to other patients so that they can find these videos and learn just like you're doing right now. So a CCI diagnosis is made by looking at all the pieces of the puzzle. Those have to fit together, imaging, exam, history. And I like to look at clusters of symptoms. Now, these are all the different CCI symptoms. The bigger the word, the more common the symptom. The smaller the word, the less common. And you can see here all the less common ones are the smaller words. So things like muscle spasms, fainting, speech issues, ear popping, frequent urination, depression, dystonia, all of those things are less common, but these were reported in CCI patients. So they can be part of the symptom complex, even though they're less common symptoms. So you just need to realize that you can have the more common things or symptoms, and that's what we look for, but you can also have those less common component symptoms as well. Now, I put together a couple of presentations that probably aren't CCI, so that if you've got one of these, you may kind of rule yourself out, or at least it's going to be less likely. You still may want to get imaging, get worked up, etc., just so that I can give you some sense of what that looks like. So example one, a patient has had symptoms begin after COVID-19. The main symptoms are lightheadedness, when getting up, and fatigue. There's no neck pain, there's no headaches, there's no trauma history or hypermobility. This is going to be less likely to be CCI. Example number two, the patient's had symptoms attributed to Lyme disease. Main symptoms are fatigue, brain fog, tachycardia, anxiety. There's no neck pain, there's no headaches, there's no trauma or hypermobility. Again, this is less consistent with CCI. And then finally, example three, the patient has had symptoms that are attributed to mold exposure. The main symptoms are sore throat, brain fog, nasal drip, muscle cramps, and frequent urination. There's no neck pain, there's no headaches, there's no imbalance, and there's no trauma history or hypermobility. Again, these symptoms are less consistent with CCI. So in summary, there are many less common CCI symptoms that patients with CCI have. Maybe they're unique to you, but some patients have some of these minor CCI symptoms that probably don't have CCI. So I've gone over a few of those examples today. So again, just because you've got the minor symptoms doesn't mean you have that you don't have CCI, but certain pictures may make it less likely that you have CCI. So hopefully that helps. And thanks so much for watching and have a great day.